Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. Kim Rich is interpreting the press conference in American Sign Language, and Carlos Saraceda is interpreting the conference in Spanish. His interpretation will be available on the county's website and YouTube page shortly after the press conference concludes. Today, Governor Newsom reminded us how differently the COVID-19 pandemic is unfolding across each part of the state of California. Local conditions vary significantly from one region to another. Yesterday, Lassen County walked back previously loosened restrictions, and Sonoma County slowed their reopening because of new outbreaks of the virus. These events are a stark reminder of the fragility of the progress we have made. The COVID-19 pandemic is not over, and we cannot go back to normal. We must all continue to be vigilant and careful. As we enter the weekend, this is a good moment to take stock of how far we have come in a very short time. Only weeks ago, we were all sheltering at home, only going out for essential tasks like grocery shopping and exercise. Retail stores were closed, and restaurants were only open for takeout and delivery. Now, more businesses are opening every day. Encouraging signs are everywhere, but with this new opportunity, there is also great risk. If we're not careful, this new activity could lead to an outbreak of the virus. Governor Newsom reminded local governments around the state that our own local progress is tied directly to our performance. We have an opportunity as a community to handle this new environment well by continuing to work together. Face coverings are now required of all county residents when going shopping or to work, and is recommended and encouraged even when outdoors. Let's take this opportunity to visibly demonstrate our solidarity and shared concern for each other by proudly wearing face coverings at every opportunity. It would be devastating to go backwards on the long road that we have ventured together. The County of Santa Barbara has created a new team of volunteer reopening ambassadors that will be out this weekend assisting local businesses safely reopen. These ambassadors will go directly to businesses that are now operating to share information and resources to help these businesses comply with COVID-19 safe operating guidelines. These reopening ambassadors want local businesses to succeed and customers and employees to be safe. More than 1,500 local businesses have already self-certified through the county's website they are safe to reopen. The ambassadors, who will be wearing blue shirts, are members of the community wellness team and will help ensure every business owner has the help they need to keep reopening going smoothly. Today, I'd like to recognize the work of Mi Vida, Mi Voz, a community coalition that is working to make health information more accessible for our Latino community. Mi Vida, Mi Voz translates to My Health, My Voice. Through the Mi Vida, Mi Voz website and newsletter, the Community Coalition is sharing information on food resources, legal resources, financial assistance, and health care. The county depends on trusted community partners to help make sure that we are all able to assist Santa Barbara County residents stay healthy and avoid contacting COVID-19. As we've talked about previously, inequity in health care has led to a situation where communities of color nationwide have been disproportionately impacted by COVID-19. The County of Santa Barbara is committed to ensuring equity in our local COVID-19 response and recovery efforts. Thank you to Mi Vida, Mi Voz and all the other community organizations that are stepping up to serve members of our community during this challenging time. To learn more, please visit MIVIDAMIVOZ.com. Next, we'll hear from Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. We are reporting 13 new community cases of COVID-19 today, for a total of 1,649 cases. 678 are community cases, 971 are cases in the prison in Lompoc. Currently, 28 hospitalized and 9 patients are in the intensive care unit. 537 of the community cases have fully recovered. We have gone through a fast-paced change in our way of life over the past week, with now extended patio restaurants, retail stores, opened hair salons and barber shops, as well as reopening of some faith-based gatherings. Most of us are getting used to wearing a mask when indoors or waiting in front of a store or while at work. We are now more aware of our physical proximity to others and are mindful of how we interact with family, friends, and strangers. We have officially come to a new normal in our effort to minimize the spread of this virus, which can be so dangerous. About a month ago, we had really warm weather and our beaches were visited by significant amounts of people. This had us initially concerned. Fortunately, it did not cause a noticeable increase in our hospitalizations or any new outbreaks. I want to remind everyone that outdoor activities are the least risky. The opening of restaurants for dine-in, as well as retail stores, barber shops, and places of worship, however, poses a higher risk of virus spread due to the nature and venue of these activities. At this point, I strongly believe we need to pause for another week or two in order to assess the impact of these newly opened activities on the spread of the virus in our area. Once we are assured that the numbers are not going up, we will be able to assess how far into the next stage of reopening we're able to go safely. Please be patient and responsible, just as you have been so far in this pandemic. Public health needs the community's support and cooperation in order to be successful. Please continue to keep a safe distance, wash your hands frequently, and wear face coverings where asked to do so. Santa Barbara County most certainly has had great success in managing this crisis so far. Our team of experts continues to watch the data very carefully on a daily basis to be able to identify any trend that would demand caution or immediate intervention. We will share more findings once available. Thank you for your cooperation.
Thank you, Dr. Hazard. I also invited Reverend Dr. David Moore, pastor of the New Covenant Worship Center, to join us today. Thank you, Reverend Moore, for your spiritual leadership during this very difficult crisis. I've always deeply appreciated your strong commitment to protecting the disadvantaged in our community.
Thank you, Greg. Churches are being called essential. During the state of emergency in which we live, I cannot just think of churches, but mosques, temples, and all places where we gather to look out for one another's spiritual and material well-being. Yes, our faith communities are essential. My perspective as a faith leader, but also as an African American, is colored by my encounters and relationships with people around the country, especially in hotspots. I have a friend who participated in the Ferguson, Missouri uprisings 6 years ago who wants to go to Minneapolis and join protests there, but his mother is on a ventilator in St. Louis fighting COVID-19. The everydayness of the African American struggle around the country and here in Santa Barbara as well is commonly overlooked. African American national religious leaders are urging caution because we are more susceptible to the novel coronavirus due to the pre-existing conditions of forced impoverishment related to redlining, hiring and firing practices, high-density housing, and lack of healthcare access, which all lead to higher rates of hypertension, diabetes, and obesity. These factors have caused us to die from the pandemic more than most. We can be categorized with indigenous nations and prison populations. We are exposed, and because of that, we may be slower to open our church campuses. And while we celebrate the caring work of all of our religious communities, I don't see the need to rush toward re-entry. We have watched armed crowds crowd government centers in some places, and we're appalled and have to ask, do they know or do they care what is happening to their African American neighbors, disproportionately represented as essential workers? It is the duty of the faith community to look out for the poor and disinherited. We are grateful for the work of hardworking local homeless advocates. We have seen faith communities empowered by foundations to do much needed outreach. This has been our congregation's experience, and we've been empowered to empower grassroots advocacy groups here in Santa Barbara who are fighting the effects of COVID-19. Still, we are dismayed at the conditions in our prisons. It is with regard to these disadvantaged members and other disadvantaged members of our community that faith communities are most essential. My own congregation meets over Zoom, and we also live stream each Sunday's service on Facebook. We recognize together that our church has never closed. Only our building is closed because we are essential. While we miss being able to lift our voices together with a full musical ensemble, it's a small price to pay to help protect our families and our community. And I do appreciate that our religious communities, some of them may be struggling financially because we are not meeting in person and some people are not comfortable giving electronically. That's a real struggle, but I pray that every participant in any religious community would do their very best to compensate, to support, to make sure that we get through this together. Despite the reopening of much in our community, COVID-19 is still within our community, and we must not let down our guard. We want to see the risk of COVID-19 gone and must continue to be vigilant in practicing safety guidelines to make this happen. Let's be family to one another. Let's save one another's, protect one another's lives. Thank you.
Thank you, Reverend Moore, for sharing your experience. Your important and timely remarks are especially valuable today. Next, Suzanne Grimacy from the Department of Behavioral Wellness is here to give us some tips on staying mentally well during the COVID-19 crisis.
Thank you, Supervisor Hart. As we have reached the end of our week again, I am feeling especially grateful for the conversations that I have had this week with community members and business owners. It is only through hearing the individual stories shared that we can truly understand the different perspectives within our community. It was through a conversation with the business owner just last evening who was sharing how her experience truly differs from others that she shared the words, "We are not in the same boat. We are weathering the same storm, but we are not in the same boat." So very true. Some are feeling uncomfortable with returning to work, but must for needed income. Others would like to return to work, but do not yet have the opportunity. Some are feeling that this time has allowed a needed pause and the ability to focus on self-care, that they feel better than they ever have before, and are worried that this may be lost when we return to a new normal. Some are sighing with relief with the reopening. Many feel confusion as to what is safe or not safe, and they're feeling vulnerable. As we're trying to figure out how to ease back into a new normal, it's important to keep in mind that we have never done this before. We must be patient and kind with ourselves and with others. We are not in the same boat, and our perspectives may differ, and this is all okay. I think it's safe to say that we are all in a different state of mind than we were a few months ago, and with certainty, we are all in this together. Our mental health may take some time to readjust. Many people may continue to feel stress, anxiety, grief, or worry. However, it's also important to remember just how far we have come and the positive things that have come from a shared experience over the last few months together. Some important things to keep in mind as people begin to return to work, businesses and our community begins to reopen. Take time for yourself to meet your basic needs with eating, staying hydrated, and sleeping. Get outdoors, move your body. When returning to work or continuing to work from home or care from others, take breaks, and during breaks, do something that's enjoyable for you. If returning to work, connect with peers in your workplace, and either way, connect with others. Respect the feelings of others. Not everyone is going to feel the same way right now, and that's okay. Stay updated with a reliable source of information, checking in a couple times a day. If returning to work, stay attentive to staff meetings and updates that may occur. And do self-check-ins. Are you feeling tired, frustrated, anxious? And if so, reach out and connect with a peer. The community wellness team remains available to connect people to resources for support and looks forward to connecting with our businesses through the reopening ambassadors that will be beginning this weekend. Thank you very much and have a great weekend.
Thank you, Suzanne. And your message about patience with ourselves and others is really important today. Thank you. Next, we'll go to questions from the room. Mr. Fish.
Yes, this is for Dr. Ansorg. I know it's early regarding a kind of a timetable after the reopenings beginning about a week ago, but wanted to know if you've been able to notice any sort of, in the confirmed cases that we've had in the week since, have any been able to be tied to any increased activity, increased openings, or any of the new businesses or spaces that may be open now, and what your general feeling is a week later after those eased restrictions?
Yeah, fortunately, those cases, the new cases are not tied to any of these reopenings, as far as we can tell. But as you already mentioned, it's sort of early because the incubation period of this virus is up to 14 days, which means if somebody caught the virus last Friday, most likely they would only get sick by tomorrow, on an average. So the next week or the next 2 weeks will be very crucial in understanding and learning for us how this pans out, whether or not the reopening had an effect on cases. So unfortunately, I cannot answer, but we haven't seen a trend so far. That's reassuring.
And then this is sort of related for Supervisor Hart from a county perspective, how you feel that the county is doing a week later after those reopenings, how you feel compliance is with masks and all of the guidelines that are still out there, and with regard to the ambassadors, was that part of the plan all along? Was that something that was come up with this week after evaluating how rules are being followed or where the path is? What kind of went into that decision?
Well, I think generally I have been very impressed by the way the community has risen to this challenge at every stage of the process. And this is a new, evolving moment. And as Ms. Grimacy said, we have to be a little bit patient with people, and we have to hope that they can to rise to the occasion. There's a learning curve involved in all of the things we're asking people to do, and we hope that they can do that quickly and integrate these new behaviors into their daily activities as soon as possible. But we're asking everybody in the county to get on board with this message as fast as possible, and not everyone will be immediately responsive as much as we'd like. So we're looking at the big picture and being real honest in evaluating that and looking at the data and moving forward at a pace that integrates that information and makes sure that that we're not going too fast. So it isn't perfect out in the community right now. There are definitely occasions when people could do a better job of wearing masks, but I think that's a matter of public education and reminding people that we're all in this together and we have a responsibility for looking out for each other as neighbors. And then in answer to the question about the ambassadors, When we began to realize that the reopening would be happening, planning was done early on to have this as an element of that, because it's important to have the one-on-one communications directly with the businesses to remind them about the things, you know, that are in the guidance from the state, that are also in the RISE guide, that need to be practiced on a daily basis in the businesses with the customers. So it's really another opportunity to educate people and remind them about what we'd like to have happening. Next, we'll go to questions on the phone.
Yes, first up we have Annika Abbott with KUIT KCOY.
Hey, I have two questions today. The first of which is, what progress has been made in figuring out why the number of cases is so much higher in Santa Maria?
Dr. Answorth, do you want to answer that?
Yeah. Our medical statistics team is really looking into this very intensely. The interviews have been completed and the data are being put together as we speak. What we know is that there are the outbreak is very spread across the city of Santa Maria or the area. There are no certain neighborhoods that are affected more than others. We know that. And we are very active in community outreach to increase the awareness of the social distancing, mask wearing, good hygiene, and so forth. And we are having a very concentrated lab drive, so to speak, this weekend in Guadalupe, where we reach out to the community and test them. That will play a role in identifying sources of the infection as well. And so it's a work in progress, and I wish I had a better answer. I still grapple with the fact that Santa Maria has so many more cases, and we honestly still are looking for the answer.
Thank you. And my second question is, what is the county doing now or planning to do to slow the number of cases in Santa Maria specifically?
Yeah, there are significant outreach projects. Our director is in close communication with city officials of Santa Maria. We are in close communication with the ag community, with employers there. We are reaching across county lines because in the northern part of the county there is a lot of movement back and forth between San Luis Obispo County to the south and Santa Barbara County to the north. And there are outreach programs in the Spanish and indigenous native language communities on social media, and not just that, but also in person. And we are hoping that we are making progress there with these activities.
Thank you.
Thank you, Annika.
Next up, we have Raisa with San Ynez Valley Star.
Happy Friday, everybody. I have two questions, and the first one is for Dr. Answorth. Is there any severity of these positive cases that you're identifying? I know that you say the number of those who are in the hospital and ICU, but the other cases, are they like cold symptoms? Are they asymptomatic? Like, what are people typically experiencing?
Yeah, very good question. It's really all over the map. There are people who are completely asymptomatic, and we pick them up with our increased testing capabilities and activities. There are people that we pick up because we do a contact investigation of a positive case, and they had no idea that they did carry a virus. They were completely without symptoms. They didn't feel like a fever or a cold or any of it. So that's the one spectrum. The other spectrum is on a ventilator in the ICU fighting for their lives. And there's everything in between. There are people who have a cough, they feel under the weather, they feel Some would even describe it as I feel like a truck ran over me because I feel so exhausted. It is awful. So it is literally a huge spectrum from no symptoms at all to the severest illness that you can imagine.
And my other question is about the masks, because people are still confused about where and when, and it just seems like, we've had so much, you shouldn't wear them outdoors, breathing them in them all the time isn't good because you're breathing your own CO2 back. And even the WHO came out and said that you should only wear a mask if you're caring for COVID victims. So I just want to have people crystal clear as to when, like, if you're outside away from other people, do you still have to wear the mask? Or if it's only like if you're in the bank and grocery store?
Yeah, thank you for that question. I really get a lot of questions about the mask, and I do understand that it is really confusing. I know. I always go back to the two basics of when you wear a mask. In the beginning, we didn't even recommend to wear a mask. We actually discouraged it. We only recommended it for people who care for COVID patients, as you mentioned. Those healthcare workers need to protect themselves with a lot of gear. They wear a gown, they wear this N95 mask, respirator, which has to be fitted, and they wear goggles and, the whole thing. Now, wearing a face covering or a procedural mask like this here, that is not to protect myself. That is to protect everybody around me who is closer to me than 6 feet apart, because if I, for instance, would carry the virus without having symptoms, I could actually infect somebody else. And the virus gets transmitted through the respiratory excretions. And obviously when we laugh or sing or breathe really heavily, those droplets travel further than if we're breathing, at a normal rate. But it is really a protection for my surroundings, wearing these. So it's a kindness for my neighbors. So the N95 mask in the hospital setting is to protect the nurse and doctor and healthcare worker. This one is to protect everybody around me from me. So because I might carry the virus, it's important to wear the mask. Now, having said that, in the outdoors, the droplets cannot travel as much because of the good ventilation. Indoors is a very different scenario. Almost all infections happen indoors. I would say more than 95% happen indoors because of the lack of ventilation, because of the accumulation, especially if many people are breathing. There was this situation in Washington in a choir where like 80% of the people singing in the choir got infected just from singing because there's more respirations when you sing. So I hope this helps to clarify the question. If you're outdoors and there's nobody around you, I would recommend not to wear a mask. Now, if you're outdoors, let's say you walk down State Street and you have no idea who is coming closer to you, you're probably better advised to wear a mask even though you're still outdoors. So outdoors is always safer, but if you cannot guarantee that you will be 6 feet apart, even outdoors it's better to wear a mask, but it's not mandated by the current health officer order. It's only mandated for indoors in order to protect everybody else.
Perfect. Thank you so much.
Thank you, Reza. Are there any other questions?
Those are all the questions we have.
Okay. It's very easy to sign up for a COVID-19 test. The process is very simple. You don't need health insurance because there is no cost. COVID-19 testing is done 7 days a week. The Lompoc test location will move to Solvang next Friday to make testing more convenient for San Ynez Valley residents. A new testing center is also open this weekend in Guadalupe. The Lompoc, Santa Maria, and Santa Barbara testing sites all have slots available. You can make an appointment at any of the testing sites anywhere in the county. To schedule a test online, go to lhi.care/COVID testing or call 888-634-1123. COVID-19 testing is critical to helping the county's public health department monitor the status of the virus. Early detection of asymptomatic COVID-19 patients is difficult and relies upon the willingness of local residents to volunteer for testing. The ability to quickly identify, isolate, and contain the virus and prevent community spread is especially from asymptomatic people is very important now as the stay-at-home order is easing and we're all getting back to work. Please make time to get tested. It can help a great deal in our effort to box in the virus. As always, please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Our next press conference will be Monday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to be considerate, kind, and safe. Thank you for joining us today.